Dissociative identity disorder. Dissociative identity disorder, previously known as multiple personality disorder, is thought to be a complex psychological condition that is likely caused by many factors, including severe trauma during early childhood, usually extreme, repetitive physical, sexual, or emotional abuse. What is dissociative identity disorder? Dissociative identity disorder is a severe form of dissociation, a mental process which produces a lack of connection in a person's thoughts, memories, feelings, actions, or sense of identity. Dissociative identity disorder is thought to stem from a combination of factors that may include trauma experienced by the person with the disorder. The dissociative aspect is thought to be a coping mechanism. The person literally shuts off or dissociates themselves from a situation or experience that's too violent, traumatic, or painful to assimilate with their conscious self. Research indicates that the cause of DID is likely a psychological response to interpersonal and environmental stresses, particularly during early childhood years when emotional neglect or abuse may interfere with personality development. As many as 99% of individuals who develop dissociative identity disorders have recognized personal histories of recurring, overpowering, and often life-threatening disturbances or traumas at a sensitive developmental stage of childhood, usually before age 6. Dissociation may also happen when there has been persistent neglect or emotional abuse, even when there has been no overt physical or sexual abuse. Findings show that families where parents were frightening and unpredictable, the children may become dissociative. Studies indicate DID affects about 1% of the population. There are several main ways in which the psychological processes of dissociative identity disorder change the way a person experiences living, including the following. Depersonalization. This is a sense of being detached from one's body and is often referred to as an out-of-body experience. Derealization. This is the feeling that the world is not real or looking foggy or far away. Amnesia. This is the failure to recall significant personal information that is so extensive it cannot be blamed on ordinary forgetfulness. There can also be microamnesias where the discussion engaged in is not remembered or the content of a meaningful conversation is forgotten from one second to the next. Identity confusion or identity alteration. Both of these involve a sense of confusion about who a person is. An example of identity confusion is when a person has trouble defining the things that interest them in life, or their political or religious or social viewpoints, or their sexual orientation, or their professional ambitions. In addition to these apparent alterations, the person may experience distortions in time, place, and situation. The DSM-5 provides the following criteria to diagnose dissociative identity disorder. 1. 2 or more distinct personalities or identity states are present, each with its own relatively enduring pattern of perceiving, relating to, and thinking about the environment and self. 2. Amnesia must occur, defined as gaps in the recall of everyday events, important personal information, and/or traumatic events. 3. The person must be distressed by the disorder or have trouble functioning in one or more major life areas because of the disorder. 4. The disturbance is not part of normal cultural or religious practices. 5. The symptoms cannot be due to the direct physiological effects of a substance, such as blackouts or chaotic behavior during alcohol intoxication, or a general medical condition, such as complex partial seizures. What's the treatment plan for dissociative identity disorder? There are currently no formal evidence-based guidelines to treat DID. Many treatments are based on case reports or are even controversial. While there's no cure for dissociative identity disorder, long-term treatment can be helpful if the patient stays committed. Effective treatment includes psychotherapy, also called talk therapy. The therapy is designed to work through whatever triggered and triggers the DID. The goal is to help fuse the separate personality traits into one consolidated personality that can control the triggers. This therapy often includes involving family members in the therapy. Hypnotherapy. Used in conjunction with psychotherapy, clinical hypnosis can be used to help access repressed memories, control some of the problematic behaviors which accompany DID, as well as help integrate the personalities into one. Adjunctive therapy. Therapies such as art or movement therapy have been shown to help people connect with parts of their mind that have been shut off to cope with trauma. Along with the dissociation and multiple or split personalities, people with dissociative identity disorders may experience a number of other psychiatric problems, including symptoms as follows: depression, mood swings, suicidal tendencies, sleep disorders, insomnia, night terrors, and sleepwalking, anxiety, panic attacks and phobias, flashbacks, reactions to stimuli or triggers, alcohol and drug abuse, compulsions and rituals, psychotic-like symptoms, including auditory and visual hallucinations, and eating disorders.